Pneumonia is a type of lung infection that causes inflammation in one or both lungs. It is usually caused by bacterial, viruses, or fungi, and it can be serious and sometimes life-threatening illness, especially in young children, older adults, and people with weakened immunity system. You guys, welcome to our video. The channel is Future Talks, and today we're going to talk about pneumonia, which is a very common infection or disease, which is very common. So we're going to talk about the causes. We're going to talk about the management or the treatment. We're going to talk about complications, and also we're going to talk about we can prevent it, and also now to handle it at all levels. Guys, welcome to our channel. The channel is Future Talks. Kindly, if you have not subscribed, please subscribe to our channel, and that is the best way in which you can also support us. Welcome, guys. Pneumonia is a type of lung infection that causes inflammation in one or both lungs. It is usually caused by bacteria or viruses or fungi, and it can be a serious and sometimes life-threatening illness. And it can be, especially in young children, older adults, and also in the people with the weakened immunity, it can be a life-threatening kind of infection or disease. How do you know somebody has pneumonia? We have signs and symptoms. For example, we have what you call the patient has developed some coughing is one of the signs where the patient gets into that problem. So coughing can be one of the signs which shows you that one has this problem of pneumonia. Pneumonia is a type of lung infection that causes inflammation in one or both lungs, and it is usually caused by bacterial viruses or fungi. And it can be a serious and sometimes life-threatening, especially in young children, older adults, and people with weakened immune systems. So we have the signs and symptoms of pneumonia, which include coughing, chest pain, fever, chills, and also difficult. We have what we call fatigue, and also muscle aches. In severe cases, we have a patient having a lot of challenges on the overall health of the same. So, and most of the time, one can be diagnosed with pneumonia through physical examination, that is through the what we call auscultation, where the doctor gets to hear the lung sounds, and there are special lung sounds which the doctor or the healthcare provider gets to find out to make that diagnosis of pneumonia. Further, the healthcare provider gets to do the chest X-rays, blood tests like the CBC, and also and other diagnostic tests to find out what happens. And in matters treatment, most of the antibiotics and also bacteria, which work on the bacteria. We have antiviral medication which can work on the viral, and also we have the antifungal which if the cause of that is fungal. So in case where the symptoms are very severe, the patient is put on supportive care where the patient gets to get oxygen, and also we have what you call a position called high focus position, where the patient is elevated on the special bed where the patient gets to rest and also get the IV fluids as necessary. On the prevention part of pneumonia, we have good hygiene practices, just such as washing the hands regularly, avoiding close contact with people who are sick, and getting vaccinated against pneumonia. So we have also vaccination of the young kids over the same, or one gets the treatment to prevent one from getting that infection. And also on the part of prevention, the patient is also advised on how to practice or what to do in the life, things like in lifestyle change, and also avoid smoking or exposure to the second and kind of smoke. So what causes pneumonia? And the etiology of pneumonia It can be caused by microorganisms such as bacteria, viruses, fungi, and less commonly parasites. The most common cause of bacterial pneumonia is Streptococcus pneumoniae, also known as pneumococcus pneumonia. So, and also we have other bacteria like Streptococcus pneumonia, also known as pneumococcus. Other bacteria include Haemophilus influenza, Legionella pneumophila, and also Mycoplasma pneumonia. So that's the part of the bacteria. And also on the part of the viral, we have in the viral pneumonia is caused by what we call influenza virus. So respiratory syncytial virus, which is called also known as RSV, and adenovirus also. Also, we have on the fungal part of pneumonia, what we call fungal pneumonia is usually caused by organisms such as Histoplasma capsulanum, and also Cryptococcus neoformans, and also Aspergillus fumigatus. Those are the on the fungal kind of infection. Pneumonia can be classified on the way it is acquired. That's the special classification of pneumonia. We have what you call community acquired pneumonia, or CAP or CAP, which is contracted outside of a hospital or healthcare setting. That's why it's called a community acquired pneumonia, or CAP, which is contracted outside of a hospital or a uh, healthcare setting. While hospital acquired pneumonia, or HAP or HAP, is a type of pneumonia that occurs in the patients who are especially on the ventilator in the hospital setting. So, the HAP is acquired during hospital stay, and also on the ventilator-associated pneumonia, or a VAP, is a type of a pneumonia that is occurs in the patients who are on mechanical ventilation. So you have certain risk factors that increase the likelihood of developing pneumonia, including age, or that is when one is very old or very young. So that is a predisposing factor to one getting the pneumonia. And also we have people with who are smokers. They are highly exposed to pneumonia. It can be the one who is smoking actively, and also it can be the one who is inactive smoker. That is the person staying with the person who is smoking. So that person gets to high likelihood of getting into that state of pneumonia. Also, people with chronic lung disease, also people with weakened immune system, like the people who have HIV and other immunosuppressive infection that are really exposed to this kind of pneumonia. Also, recent respiratory viral infection and exposure to certain chemicals or pollutants, especially those people who work in chemical plants. There's a high risk, because that's why they are advised to be highly guarded, and also take the protective gears as appropriate, so that they can get prevented from that kind of infection. On the part of treatment, when one has pneumonia, like I said, it can be caused by bacteria, viral, it can be fungal. Depending on the cause, the underlying cause, severity of the illness, and the patient's overall health, treatment usually involves combination of medication and supportive care. If the pneumonia is caused by bacteria, typically involves the use of antibiotics. In Africa, most of the time we use what you call ceftriaxone and other antibiotics, strong antibiotics like vancomycin also is involved at a certain level of treatment. So the choice of antibiotic will depend on the type of bacteria that is causing the infection. That's why now here where microbiology, or finding the causative organism through the lab for specific treatment of the pneumonia. So the causative organism is very important. And the antibiotic will depend on the type of bacteria that is causing the infection, as well as the patient's age, health status, and other factors. So these antibiotics can be given orally or intravenously, that is through the vein, and also or through the mouth, depending on the severity of the illness. If the patient is caused by, if the patient's especially the severity of the disease is not very much. Normally, the patient is treated as an outpatient and gets to go home. But if there's a lot of the patient is sick, and also we have other factors which are considered, the patient can be put in patient and also get the through the intravenous kind of those antibiotics or the drugs as needed in the ward. So, in addition to medication, supportive care is important to patients with pneumonia, especially those patients who are very sick. We have what you call oxygen therapy, where the patient is administered oxygen through a special way. If the patient is dehydrated, hydration is done through the special fluids which are given through the vein. And also, rest is also involved, where the patient is elevated in a good angle to ease the breathing through the lungs. And fever management is when the patient has a lot of fever. So, especially with the acetaminophen or the ibuprofen are given to get the fever to the normal levels. For patients with a severe pneumonia or those with underlying medical conditions, hospitalization may be necessary. In the hospital, the patient can receive more intensive treatment, such as oxygen therapy, as I've said. Intravenous fluids can be given and close monitoring also. In order to prevent complication and reduce the risk of recurrence, it is important for patients to complete the full course of medication as prescribed by their healthcare provider, even if they begin to feel better. This is very important because we don't want to get the patient to get into antibiotic resistance, where now we give a patient the drug, it can't work for the next time. So it is highly advisable for the patient, if you are started on those medications for the pneumonia, that you get to finish them so that to avoid resistance to certain medication or to that bacteria which is causing it. So it is important to get plenty of rest, stay hydrated, especially for the patients who are at home or are given medication and they're supposed to go home. So it is important that they get well hydrated, plenty of rest, and follow additional instructions as provided by the healthcare provider. How does one reach the diagnosis of a pneumonia? The doctors use or the healthcare providers use a special way of finding what is happening. Very important from the medical history. This is where you are asked about if you have had a condition like that. So, you are asked some questions if you have ever been treated of something, maybe where you work also, because the work is also can be related to that, if you have gotten any immunization from the medical history. Also, physical examinations, where the doctor gets to examine the patients and especially check on the breathing system and also check on the lungs, how they're working through that, what you call a stethoscope, the stethoscope placed on the breathing areas, so as to find how the breathing patterns are and how the patient is faring on. So during the medical examination and on the diagnostic part of it, during the medical history, the healthcare provider will ask the patient about their symptoms, such as if the patient also they are coughing, chest pain, fever, chills, difficulty in breathing, and fatigue. They will also ask about their any underlying medical condition or risk factors, like I said about the patients who are HIV positive, yeah, and patients who have other breathing or respiratory conditions. That's where the doctor or the healthcare provider gets to capture those ones. So, and during the physical examination, as I've said, the healthcare provider will listen to the patient's lungs with a stethoscope to check for abnormal sounds such as crackles, wheezes. Those are special sounds which the doctor gets to listen to, or decreased breath sounds. They may also check the patient's temperature and look for other signs of infection such as rapid heart rate and low blood pressure. So very important. Let's note that your healthcare provider tell you you have pneumonia without those special examinations, because also they assist in, also they can determine on how your lungs are doing. Also, we also check the oxygen saturation on your system through a special machine which is called SpO2 machine, which can check on also how the oxygen concentration is on the body, because when it is compromised, it can be also a very good sign that the patient has pneumonia, especially the patient with rapid heart rate or low blood pressure at the same time, patient with crackles and wheezes. So very important, it can be done. And also in the diagnostic part of it, the doctor or the care provider can do the x-rays of the chest, especially blood tests, especially the CBC, and also the sputum cultures can be done so that to make a diagnosis over the same. So a chest X-ray can help to confirm the presence of pneumonia and determine the extent of the infection. Blood test can provide information about the presence of the bacteria as well as indicators of the inflammation. Sputum cultures can help to identify the specific microorganism causing the pneumonia, which can help guide the treatment. In some cases, additional tests may be necessary, such as CT scan or a bronchoscopy. A CT scan can provide more detailed information more than the X-ray, so that to see how the lungs are doing and help identify any complication of pneumonia. Especially for the complicated pneumonia, it's very important that this X-ray and this advanced way, apart from the X-ray, the CT scan is done to provide detailed information about the lungs and help identify any complication of pneumonia, especially where the patient now has lung abscesses or a pleural, what you call pleural effusion, or we have now water accumulated in the lungs. So the bronchoscopy involves using a flexible tube with a camera to examine inside the lungs and also collect samples for the lung tissue for fluid analysis. So those are the special ways of making that diagnosis through the lab work and through the CT scan, through the X-rays, and also for through examination, where the doctor can also make that diagnosis. How can you prevent pneumonia? Prevention of pneumonia involves several measures that can be able to reduce the risk of contracting the infection. Some of the preventive measures are: number one, and very important, is vaccination. Like here in Africa, the kids are vaccinated against pneumonia. It's on the schedule of the immunization. So vaccination is one of the most effective ways to prevent pneumonia. And what we give here in Africa is called pneumococcal vaccine. It was recently introduced into the schedule because pneumonia was one of the number one diseases which was seen to be killing the young kids. So pneumococcal vaccine is very important on the part of vaccine because and also the influenza vaccine are two vaccines that can prevent pneumonia. So for the pneumococcal vaccine protects against the most common cause of bacterial pneumonia, Streptococcus pneumoniae, and is recommended for young children, older adults, and people with certain medical conditions. The influenza vaccine can help prevent viral pneumonia and is recommended for everyone, especially those at a high risk of complications from the flu. But you get this kind of also vaccines that they are seen to work very well. It's on the schedule of the vaccination of especially of the kids. But at a certain level, it can be given to adults depending on the severity and also the risk involved for such kind of people. And also another way of preventing it, apart from the vaccination, we have good hygiene practices. Like practicing good hygiene can help prevent spread of germs that can cause pneumonia. These include washing hands frequently with soap and water, avoiding close contact with people who are sick, and covering the mouth and nose when coughing or sneezing. So good hygiene practice is very important. When you are sneezing, you always cover your mouth. And also, always, especially for the healthcare provider, because they get to touch a lot of people. And those people also, if you greet people, that's why we want to do good hand hygiene. So it's very important that you always will get to wash your hands regularly, especially because people touch a lot of things, because we touch a lot of things. So hand washing is very important in this, and also the when sneezing and also and other things, get to get it very well so that you don't get to contract that condition. And also for the smokers, as a matter of prevention, they're supposed to quit smoking. Because smoking damages the lungs and weakens the immune system, making it harder for the body to fight the infection. So quitting can help reduce the risk of developing pneumonia. This involves also those people who stay with the smokers. It's very important that you also know that you're at risk of contracting pneumonia as an inactive smoker also. So very important that we get to avoid exposure like that. Another way of preventing pneumonia is maintain a health lifestyle, eating a health diet, getting regular exercise, and getting enough sleep can also help to boost immunity and reduce the risk of developing pneumonia. And another way of preventing is avoid exposure to pollutants. Exposure to pollutants such as smoke, chemicals, especially those people working in chemical plants, and air pollution can damage the lungs and increase the risk of developing pneumonia. Avoid exposure to these pollutants can help reduce the risk of developing pneumonia. But last but not least, on the best way also to prevent this is manage underlying medical conditions. So, like people who have things like pneumonia, who have chronic conditions like diabetes, sorry, and also heart diseases, lung diseases can increase the risk of developing pneumonia. So it is highly recommended that those people with diabetes, heart diseases, and lung diseases, they are put on check, be on the right treatment. So if you are diabetic, you are hypertensive, you have other underlying conditions like TB also, get to the right treatment and also get in contact always with your doctor or your healthcare provider, because we don't want you to get into such kind of a condition like pneumonia. And especially, sorry for that, those people, especially with HIV, because the HIV clearly reduces the immunity. It's very important that you manage you are on the right treatment and at the right time, and also doing very well on treatment, also always on checkup with your doctor, so that we avoid the risk of you getting into that condition. Also, when this pneumonia is not managed well, it leads to other complications. And so, pneumonia sometimes leads to complications, especially in individuals with a weakened immune system or underlying medical conditions. Some potential complication of pneumonia can be respiratory failure. This is where now pneumonia can cause severe inflammation and fluid buildup in the lungs, which can lead to respiratory failure. That means now your breathing system is really compromised. A condition where now the lungs can no longer supply the body with enough oxygen, because the oxygen is very important for our body system. So when it leads to respiratory failure, it's not a good complication. This is now patients who are put on a ventilator to help them breathe. Another very serious complication which can come about with pneumonia is sepsis. Pneumonia can lead to sepsis, which is a life-threatening condition where the body's response to infections causes damage to its own tissues and organ. So we have a serious problem when we have sepsis through poorly managed pneumonia due to some conditions. So we have what you call now sepsis at that point. It can also lead to lung abscesses. In some cases, pneumonia can cause abscesses to form in the lungs, which are pockets of pus that require drainage or surgical removal. So lung abscesses actually is pus now in the lungs, and pus is not very important, is not very interesting. We have now pockets of pus in the lungs due to that, and this now can predispose a patient to be done surgery so that that pus can be drained out of the lungs, because we don't need pus in the lungs. And we are also, as a complication, we have pleural effusion. Pleural effusion can be caused by pneumonia because of the fluid buildup in the lungs or the pleural cavity. The space between the lungs and the chest is full of water now, which can cause very difficulty in breathing, and this also can require drainage. So it can be very detrimental when it comes to that level, where now we have that pleural effusion, and the patient may present with very serious condition at that point. As a complication also, we may have what you call emphysema or empyema. Pneumonia can lead to empyema, a condition where pus accumulates in the pleural cavity and it requires drainage or surgical removal. Now when pus forms within that cavity between the chest and the lungs, that's what we call empyema. Now it becomes a big issue where now patient needs a special surgery, the special doctor to manage it. Also, at that point now also as a complication, we may have what you call kidney failure. So pneumonia can lead to kidney failure, especially in older adults and people with underlying medical conditions. And when we have kidney failure now, we're heading to dialysis, and then now we can be on the end stage where the patient now gets into a big problem and now cannot be helped. And another complication is meningitis. In rare cases also, pneumonia can lead to meningitis, a serious infection of the lining of the brain and the spinal cord. With now the spread of highly infection in the body, we may have meningitis, and which can be very not very interesting at this point, where now the patient gets into a lot of problems. So, guys, welcome to our channel. The channel is Future Talks. We are talking about pneumonia. It is important to seek medical attention as appropriate and very fast. When you suspect pneumonia, especially if you have a weakened immune system and you have an underlying condition, kindly always run to the hospital and seek proper attention. And I highly recommend that you go to a qualified healthcare practitioner so that you get help as early as possible. We don't want you to get into problems and also get into complications, because as much as your health is compromised, your finance can get compromised at the same time, because it's very difficult to manage the complications of pneumonia. Guys, welcome to our video and also welcome to our next video. The channel is Future Talks. Kindly, if you have not subscribed, subscribe to our channel. And also, guys, welcome to the next one. Thank you very much, guys. Pneumonia is a type of lung infection that causes inflammation in one or both lungs. It is usually caused by bacterial, viruses, or fungi, and it can be serious and sometimes life-threatening illness, especially in young children, older adults, and people with weakened immunity system.